Hi, I'm Ed Boudreau. I'm a clinical psychologist and behavioral health consultant.
And I'm Archie Hamilton, G1 Task Lead with Adam Alliance.
We'd like to welcome you to this enhanced bite-sized learning. This presentation is the third in a three-part series on basic alcohol counseling strategies. Today we'll focus on using a readiness ruler to assess readiness to change and to prompt a motivational discussion. This presentation will highlight the following performance elements. Number one, using a readiness ruler. Obtaining a better understanding of the individual's readiness to change their alcohol use can help guide discussions and map out an action plan. There are many ways to assess readiness, but the 0 to 10-point ruler is a common one used in motivational interviewing, so we'll explore that in this presentation. Point number two, increasing change talk. A basic principle of behavior change counseling proposes that the more a patient talks about change, the more likely they are to commit to change and to eventually make behavior changes. Readiness rulers can be used to help increase change talk, even in patients who are not ready to commit to action. In the presentation, we will begin with a vignette that depicts a wellness visit where the risky drinking was identified through structured alcohol use screening as part of a wellness survey administered by the medical assistant. We will explore how to handle three different readiness ratings aligning with low, medium, and high readiness. We will begin the role play now. Okay, Archie, I see you're here for an annual well visit.
Yeah, that's right, Doc. Just doing the old tune-up.
All right, great. So I reviewed your wellness survey before I came in, so thank you for taking the time to fill that out. And overall, it looks like you've been feeling pretty good and that things seem to be going well. There were just a few things I wanted to ask you about. So let's start with some of the health behaviors. I noticed that in the section that asks about alcohol use, you stated that you drink nearly every day, usually around 2 drinks a day, and that you drink more than 4 drinks a day on a weekly basis. Does that sound about right?
Yeah, more or less. Sometimes it's a little more, sometimes a little less.
Okay. Have you noticed your drinking causes you any problems?
No, not really, Doc.
Oh, well, that's good. So I have to ask these questions to make sure we're not missing anything important. It's good that you've noticed that you haven't had any problems. We have some guidelines for drinking that researchers have shown help to prevent people from developing problems in the future. So I just wanted to review these with you briefly. For a man who's 70 years old, like you are, we recommend not drinking more than 7 drinks a week total, and not drinking more than 3 drinks on any given day. So from your screener, it seems like you probably drink a little bit more than that. Does that seem right?
Yeah, I guess so, but I mean, I don't really have any problems. I've drank like this most of my life. My wife is fine with it. I don't drive when I'm drunk.
Well, those are really very important. So don't worry, I'm not going to tell you to stop drinking. That's really up to you. I just want to share with you some information that many people don't know. The best way to make sure you don't develop problems in the future, like high blood pressure or heart disease or falls, is to reduce your drinking to below the recommended amount. So what that would mean for you is trying not to drink more than 7 drinks a week and not drinking any more than 3 a day. What do you think of that kind of goal for your drinking?
Well, I don't know. I'm not really sure. I haven't really thought about it.
Okay, I'm glad we're talking about it then. How about this? If you were to rate your readiness to reduce your drinking to these low-risk limits on a 0 to 10-point scale, with 0 being you're not at all ready to change your drinking, and 10 being you're 100% ready to change your drinking, where would you rate yourself right now?
I don't know. I guess maybe a 2.
Okay, so it seems like you have at least a little interest in changing. Tell me a bit more about why you're a 2 and not something lower like a 0 or a 1.
Well, I guess it's because you're telling me it would be healthier for me. I really haven't thought about changing until you told me about this, so I guess I'm a little bit ready, but I don't really see it as a problem. So I'm not very inclined to stop drinking or even cut back.
Okay, I get it. You want to be healthy, so you have some readiness, but you like drinking and haven't found it to be really a problem, so you don't want to change. So that's fine. I understand that. How about this? I want to give you a short brochure that describes some of the health problems that can be associated with drinking and what the low risk drinking guidelines are, so you can have it available. Can you agree that you'll review it and pay attention more closely to how much you're drinking, and we can meet again in 6 months to discuss it again? You don't even have to agree to change how much you're drinking, so only to review the information and to monitor your drinking more closely so we can get a more accurate picture of what's going on, and we can go from there.
Okay, Doc, sure. I can do that. I'll see you in a few months.
Okay, great. This concludes our first role play of someone with low readiness. Notice that I was flexible and tried to meet the patient where he was. A readiness to change of a 2 suggests that actual behavior change is not likely. But I decided to engage him in change talk by asking why his score wasn't even lower than a 2. It forced him to describe his motivation to change, even though it was just a little bit. And I concluded by trying to simply increase his awareness and plan for additional discussion, which can possibly segue into action later. We will now transition to our second role play. We will assume that all of the initial discussion for case 1 is the same, so the starting point's the same, but instead of providing a readiness ruler rating of 2, he provided a readiness rating of 5, and we'll take it from there. Okay, Archie, so you're a 5 on your readiness to change. So what makes you a 5 and not, I don't know, say a 2 or a 3?
I don't know, really. I guess you're telling me that it could be healthier for me if I cut back. Makes me consider it.
Okay, well, that's a good thing, I think. So besides the potential health benefits of drinking that we were talking about, are there other things that make you ready to drink less? Like, sometimes maybe you do or say things that you later regret, or the extra calories that come with drinking, or the cost?
Well, I guess, now that you mention it, I have been adding to the spare tire lately, and I know that the beer has a lot of calories. I even switched to light beer last year, which I don't even like.
Okay, so I see. So you were concerned about weight gain too. So health and weight gain are obviously some important reasons to consider making some adjustments. How about this? Let's try a little experiment. You mentioned that you often have more than 4 drinks on some days during the week. Maybe you can just cut back on the number of drinks you have in a day to no more than 3. Maybe you can try it out and see how it goes for a few weeks.
Sure, I guess I can do that.
Okay, great. I'll give you this brochure that describes some of the health problems that can be associated with drinking and what the low-risk drinking guidelines are. So you can read it. Try to keep your max drinks to no more than 3 a day, and I can see you in a month to review how you're doing.
Okay, that sounds good.
This concludes this section of the role play. Note that, like the first scenario, I asked the patient about why he was at a 5 and not lower in order for him to engage in change talk. I also had this patient commit to a little more change, but presented it in a non-threatening way as an experiment and focused on a small change, like the max drinks per day. We will now conclude with a scenario where the individual is highly ready to change. Okay, Archie, so you are an 8 or a 9 on your readiness to change your drinking. That's really high. It sounds like you're pretty motivated.
Yes, I am.
Can you tell me a little bit more about why you're so motivated?
Well, like you just told me, Doc, it's better for my health. Plus, I have to admit that I've noticed I've been drinking a little more than I want to sometimes. Makes me kind of short with my wife and a little groggy the next morning. And I've been gaining weight, and the drinking don't help. So I heard the other day on the radio that drinking can cause cancer, too. I guess it's probably time for me to cut back a bit.
Okay, those are all really good reasons to change. So how about this? I'll give you this brochure that describes some of the health problems that can be associated with drinking and what the low-risk drinking guidelines are. You can read it, try to follow the guidelines. That means you'll cut back to no more than 7 drinks a week and no more than 3 drinks on any given day. And I can see you in 6 months to see how you're doing.
Okay, sounds good. I'm on it, Doc. It won't be easy, but, I'm going to give it a try.
Okay, great. That's really all I'm asking for. So let's talk about it more at your next appointment. Okay, we'll conclude the third role play here. Note that even though the patient was highly ready to change, I still engaged him in some change talk to clarify his motivation. Also, I pressed him to commit to following the entire low-risk drinking guideline, even the weekly total, as well as the daily max. So in summary, the readiness rulers can be used to gauge motivation to change, increase change talk, and set appropriate goals, ranging from more awareness and monitoring goals for those lower in motivation to behavior change for those who are higher in motivation. Thank you.